So thank you so much for joining us today for Explore Careers in Environmental Health. My name is Jenny Rudolph, and I work for the Coalition of Local Health Officials here in the state of Oregon. We're a very small nonprofit, but we exist to support our local county health departments with policy and advocacy, and then I do workforce. We're holding this session today because there are a number of environmental health specialist positions open at the county level. And we really want to help connect great folks like all of you on the call today to those jobs, and also to kind of demystify, hopefully, or clarify the process of how to really get into the field of environmental health at the local level in Oregon. So I am certainly not an expert on the topic. I am just our guide today, but I have brought with me a couple of really wonderful local environmental health experts who are going to be our resource today on our panel. And those folks are Julie Hamilton, who's the Environmental Health Program Manager in Clackamas County, and Kyle Stropes, who's the Environmental Health Modernization Specialist in Klamath County. So thank you both so much for joining us today. I'm going to be peppering them with questions throughout our presentation. And to kick us off, I would love for each of you to introduce yourself a little bit more for the group and tell us what you do. I know you both wear many hats, so tell us a little bit about that. And then also, if you wouldn't mind sharing what first inspired you to get into the field of environmental health. And Julie, do you want to go first?
Sure. Hello, everyone, and thank you for joining us. I'm Julie Hamilton. I use she, her pronouns. I've been an environmental health specialist for over 25 years. It seems like yesterday. I started in the state of California, and then I've been working in Clackamas County for about 21 years now. The areas we do in Clackamas County are food safety with restaurants and mobile units and pools and spas and lodging facilities like hotels, RV parks, and camps. We work with childcare, schools, drinking water. Yeah, we do a lot. So that's really fun and really diverse. I was inspired to work in environmental health during my last year of college. I had a degree in biology and I wanted to continue in school, but my husband said, maybe you should get a job. And so I wasn't sure what to do. And one day I was talking to a fellow student, and the computer technician working in the lab overheard us and suggested this field. And so I started looking into it. And I haven't looked back since I got my first job. It's been really exciting and fun and rewarding.
That's wonderful. Thank you, Julie. Kyle, how about you?
Yeah, Kyle Stropes. I'm the environmental health modernization specialist, air quality specialist. Yeah, just a lot of hats that I wear for Klamath County Public Health. I have about 8 years of experience as an environmental health specialist in total, 4 here in Oregon and 4 back in Kansas. I similarly to what Julie said, I do routine safety and sanitation inspections. That includes restaurants, pools, food trucks, campgrounds. I'm the main organized campground inspector for Klamath County. We also look at water systems, and part of my role is also being the mean guy when it comes to air quality ordinance enforcement. So yeah, and then kind of an odd title I have for modernization. The state of Oregon is trying to modernize its approaches to water safety, water quality, and heat-related illnesses and non-infectious respiratory illnesses as well. I play a role into that to help Klamath County community members try to not have to experience those kind of nasty things. So, and then what inspired me to choose my career? Well, I enjoyed environmental sciences going through high school, and I even got my degree in soils and environmental science through Kansas State. It was oddly enough, that my hometown slash county EH department needed a dirt nerd like me for their wastewater system evaluations. So that's how I got roped into the world of environmental health and enjoyed it since.
That's so great. Thank you so much. And thank you both again for taking the time, because I know, summer is a busy time for environmental health. So we appreciate you both being here today. One of the projects that I got to do last summer, which was so fun, was actually go to visit 5 different county public health departments and interview their folks for a video project that we did. And we were able to create a great video all on environmental health, featuring 2 of our friends, Gina Egan in Marion County and Mike Chrisman in Multnomah County. Did a little ride along with them. And so I'm going to share that with you today. This little video, it's about 3 minutes long, and hopefully you can hear it all right, but please tell me if for some reason it's not working.
Public health is all around us. When you woke up this morning, you opened the tap to brush your teeth. The water was clean, and that's because of public health. Or during your lunch, if you stop at a restaurant, public health does inspection at the restaurants to prevent people from getting infection or diseases from the food they're eating. And so public health does save our lives every single day.
I think public health is one of the few professions or careers that has both an indirect and direct impact on every single person that lives in the community.
My name is Mike Chrisman. I'm a registered environmental health specialist. Well, I was fortunate enough that actually environmental health chose me. I was introduced to a gentleman that was environmental health specialist. He asked if I would like to job shadow. Very first day I went out with him, I'm like, this is the path I want.
I'm Gina Egan, and I am a health inspector for Marion County. I decided to go into public health because I wanted to use my love of science and also a long history in food service and marry those 2 together and use that to help prevent foodborne illness.
Everything about the job I love. Every day is different. You can be a food regulatory person, you can work in wastewater, you can work in air quality, you can work on epidemiology, public drinking water. There's so many fields you can go into.
If it's a gorgeous day, you want to work outside, you can go inspect pools, all day. If it's raining, you want to go inspect your harder restaurants because you're going to be in there for a while. You register as a trainee. The people who are already working there will take you along and train you.
You have to have a degree. It has to be specifically in some sciences.
And then when the time comes and you have enough hours in, then you take your test, and then you can move on to being a registered environmental health specialist.
I get to work within the community I serve. I get to be an educator when I'm out doing those inspections. And when you see their body language and their smile, that you know they've got it. And you've kind of got them forever as an educator, that they're going to always listen to you and respect you, and they're going to come to you and have that discussion because they know they can trust you, come up with a solution, a workable solution.
I think the work I do as a health inspector is meaningful because we can contribute to maybe stopping an outbreak or just helping a restaurant thrive.
I get to know them on a personal basis. I try to build a rapport, trust with operators.
It is a really fabulous opportunity to help the community and to do work that makes you feel productive. It's a fun and a fulfilling career.
Public health makes a huge difference in the community. It's all around us. It is the air that we breathe, the water that we drink, the food that we eat. There's so many ways that public health is helping our community. It's actually hard to talk about in a soundbite.
There's a place for everyone.
There's a place for everyone.
Everyone. There's a place for everyone in public health.
Public
Okay, so thank you so much for watching that little video. And just so you know, if any of you have the opportunity to share that with your networks, I know we have some folks on the call here that work in higher ed and work with students, so that's a great thing to include. so that people can get a little bit better idea of what environmental health specialists actually do. But before we go on to the information on this slide, I wanted to ask Kyle and Julie to tell us a little bit more about the aspects of their work that they really enjoy. So what do you most enjoy about your job? And maybe what was the last thing about your job that made you smile that you want to share with us?
Oh man. So I enjoy the consistency of my job. We do a lot of different things for sure, but the ability to just say, hey, I'm going to go do these set inspections for the day, and that takes care of most of the day because you're out there for quite some time. But that is very enjoyable, just being able to almost pick your schedule on what you want to get done for the day, and make your own little checklists on how you want to get it done, the routes you take, all that kind of things. And what makes me smile about that is sometimes you have more relaxed inspections for like food vendors at farmers markets or at a fairgrounds. You get to actually talk with the operator, learn what they're doing, how they're cooking their food. I just got back from a July 4th one, last week during a food vendor event, and the guy was teaching me how he cooks his chicken a certain way. It's very different than what I'm used to. He was showing me the entire process. We had good conversations. I get to talk with people who are doing fundraising for specific events too, what their project that they're fundraising for is. I really enjoy that kind of aspect of my job for sure. So,
Thank you. Julie, how about you?
Yeah, I think for me, my favorite part of the job is working with people and the relationships that we build. Walking into somewhere for the first time and you can see the fear on their face because they're getting inspected. But being able to take what you know from science and the regulations in place and be able to translate them to the way they would apply in their business and what they're doing, and help them have the power to make decisions how they're going to approach it, and to just work with them and educate and support them, and really help them take charge of being able to operate safely. And it really helps them build their business and protect their business as well as their customers and the economy of our community too. So it's really rewarding when you see that shift from them being afraid of you when you walk in to being happy to see you and engaging and having those conversations and asking you questions and being forthcoming with what's happening. And so because they know you can work with them and work together on problem solving. So those incidents always make me smile as well. And yeah, thanks.
That's so great. So you've seen a little bit now in terms of what environmental health does at the local level. But to explain it a little bit more, so we all have kind of a shared knowledge or understanding of exactly what environmental health does at the county level. Environmental health is one of 4 foundational public health services in the public health modernization framework. So Kyle kind of mentioned that because Kyle does modernization. So we're going to draw on him here. So this framework is meant to be a guide in terms of whatever county, whatever community you go into across the state of Oregon and nationally as well. These are the core public health services that you should be able to find. And environmental health is a really important piece of that and is one of the 4 foundational services. Here in the state of Oregon, we do have a decentralized public health system. That means there's a lot of local control over what public health services are offered and kind of how they're offered, what that looks like. But in general, environmental health specialists perform a wide array of functions, everything from identifying health hazards, surveillance of hygiene and sanitation systems, food and water safety, waste management, ensuring safety of public swimming pools, lodging, child care facilities, vector-borne disease control, and then the built environment, which is kind of policies and plans that prioritize the health and safety of the community. So that's a lot of different hats to wear, and each county is very different. So for our panel, Julie, maybe you want to start tell us a little bit about the areas of environmental health that you work in specifically, or your program does, and any special environmental health programs or initiatives that you'd like to call out that might make your county maybe a little bit different from others.
Yes, thank you. So as mentioned in our introduction, our program in Clackamas County in environmental health regulates the food, the pool, those types of lodging facilities that I listed. We do drinking water, and Clackamas County has one of the largest inventory of drinking water systems at the county level. So we have a very robust program for that as well. And I think, each county does vary a little bit. The thing I like in Clackamas County is we have a little bit of other work that comes up. It really depends on what's happening in our community, but we work with our infectious or our communicable disease team for things like lead investigations. So if a child is tested with elevated levels of lead in their blood, we can step in and assist if they're unable to determine how the child is getting exposed to lead. We can go out to the environment and work with the parents or the school or wherever it's happening and see if we can help sort out where the lead is coming from so that they can remove that exposure and then help the child stop getting lead in their blood and getting sick from it. And we have other examples of that, foodborne illness outbreak investigations. So when the community is getting sick, most of the time in foodborne illness situations, something they ate, something they drank, even sometimes where they've gone swimming, we can go out in environmental health and try and figure out what's causing the illnesses to happen. So then we can put in interventions to stop the spread and then educate and work with whatever the exposure is so it doesn't happen again in the future. So that's really fun, really rewarding work. It's kind of like being a detective. So I enjoy that aspect of being able to help when those things are happening. Once in a while, we get called in to help with rabies exposures when someone gets bit by an animal. So those can be really fun times. And then I also enjoy the work when we are responding or preparing even to respond to emergencies, whether it's a natural disaster or some other incident. So sometimes we'll have the wildfires and we have community shelters, and they'll call out environmental health to work with the shelter during the setup to make sure that people coming to the shelter aren't going to get hurt or sick. And we have other situations. If we have a flood in our community, we can help homeowners that have private wells or recovery in coming back into their home. We can provide, excuse me, education and resources to help our community during all of these emergencies and incidents be a bit safer and healthier during and afterwards.
Thank you so much. Kyle, how about Klamath County?
Oh man, I think Julie covered most of what we do. And I mean, yeah, some counties are going to be a little bit different in what services they provide or don't provide. But we do a lot of what Julie talked about. For example, I'm the lead risk assessor for Klamath County when it comes to elevated blood levels for child exposure cases, but part of my role as well is the modernization aspect. And that can be hard to explain in a short snippet today. But think of like heat-related illnesses or wildfire smoke impacting communities. I try to be the one that recruits cleaner, cooler air spaces for people to go to. I try to help set up air quality monitor networks so that we can see how bad air quality is outdoors, and for people to educate themselves on, hey, do I need to stay? Should I go outside? Should I stay inside? How bad is the air quality right now? That's kind of what I lean in towards. There's other aspects of modernization that I'm still trying to figure out too, but it is very wide ranging in what we kind of do. And then in terms of programs that I like to call out, I mean, a lot of you folks are just kind of interested in environmental health specialist kind of roles. And as trainees is what we start off in here in Oregon. We actually have a study group that is fantastic to work with, to get you going, to get you ready for the EHS exam that you have to take, to help you understand how many hours you need to get registered, And I'm biased in saying it because I'm part of that group in terms of the wastewater and soils discussion with the REHS training group. It's fantastic. So if you do join us, that's one of the great ways to get ready for your exam. So
Thank you so much, Kyle. And I feel like you totally set us up for the next slide. So good job. So next we're going to talk a little bit about career pathways and kind of like how do you break into this field of environmental health? If you are kind of, you obviously all of you who are joining this today do have an interest in environmental health. And so for people who are thinking about trying to get into it or maybe trying to test their hypothesis, right? Is this work for me? There are some entry-level position titles that you may want to look at. I've pulled a few of them here. Some counties do hire vector control technicians as seasonal jobs. And so those are typically in the summer during like the height of mosquito and tick season. And so Washington County, for example, has these jobs and a lot of other counties do. And so great things to do for students, right? To get a little bit more experience of what environmental health is during the summer. We also have very interesting positions called youth inspectors or young adult inspectors. And this is actually in the tobacco prevention program, which isn't necessarily under environmental health, but they're basically minor decoys. So they go into tobacco retail establishments and try and purchase products and see whether or not they get carded. And then they're also doing some environmental scans to see, placement of products and things like that. So it's kind of like a health inspection. It's similar work. And you have to, this is really specific. You have to be between the ages of 18 and 20 to do that job, but it's very flexible, hours. It's not like a full-time job or anything. It's really flexible, short hours, and a great way for young folks, even who are maybe just graduated from high school, to kind of get a little taste of public health and environmental health. NEHA, which is the National Environmental Health Association, also has a paid environmental health internship program. It is national, but then they help match you with a local environmental health program where you actually do the internship and you can get paid doing that. So I've got a link in here. You can go check that out if that is interesting to you. And then lots of counties across the state work with students all the time on various internships, whether it's undergraduate students or graduate students. And so Julie and Kyle, maybe you want to talk about, do you ever accept students, take on students, or are there any other kind of entry-level type jobs that you all hire for down there?
yeah, we've had interns the past 2 summers that have at least accompanied us on water system surveys and food inspections. So we do that to get their foot in the door. One of my coworkers did that as well before he joined us and just shadowed an environmental health specialist. And that was a great kind of eye opener for him in terms of the different tasks that you'll do throughout the day. So yeah.
That's great. And how about you all, Julie, in Clackamas County?
Yeah, we've had a couple interns as well through the university program. And then we have people that sometimes would like to shadow. Our county is a little fussy about liability, so it's harder for us to bring someone on without that, but we could make arrangements potentially if I'm able to get approval. We also do have the tobacco retail licensing program and work with young adult inspectors in our public health here at Clackamas County. So there are those opportunities as well. So yeah, those are the ones I can think of.
Great, thank you so much. And most county public health internships are unpaid, although sometimes there are paid ones. For example, in Multnomah County, they have a program called the College to County program, and lots of different programs and departments across the entire county host interns, and they are paid. So there are some of those out there. But a lot of times it would be an unpaid opportunity. But I always feel like doing that or a ride along even is very eye-opening for folks because the job isn't necessarily for everyone. So, it's good to get a little taste of like what would be happening on a day-to-day basis. So I'm glad that you all are working with students on that. So if folks are in fact interested in becoming a registered environmental health specialist, there is a very specific process that you have to go through to do that. And so we're going to talk about that next. And Kyle already mentioned these trainee positions. And I love this because it's basically an apprenticeship. It's a paid, training program essentially in public health, which we have very few of. So it's a really cool thing. So let's learn a little bit more about what a trainee is. So these are paid pathways to become a fully registered environmental health specialist. You have to perform the duties of the job under the supervision of a qualified environmental health professional. So a registered environmental health specialist like a Julie or a Kyle. During your trainee position, you're working towards becoming fully registered through the Environmental Health Registration Board, and you have to get 2 years of qualifying work experience, which is 3,840 hours. If you have a bachelor's degree, or that goes down to 1 year. If you have a master's in public health or community health, that's 1,920 hours. So that's the length basically of the trainee position. And then during that time, you're studying to take the board exam. I've got a link in here to Oregon uses the National Environmental Health Association board examination. And as Kyle mentioned, there's a study group. So Oregon Environmental Health Association is an affiliate of the national one. And then they have the study groups to help trainees study to pass their board exam. So it is quite a process, right? Kyle, do you want to tell us a little bit more about kind of the trainee process? Like, what does that look like in your county?
No, that's a good question. For trainees, we try to do, when they first join, we try to get them to both be in the books and on the job with us and out in the field. We know how much knowledge there is in terms of what has to be soaked up for the test. It can be very daunting. The number of hours that's listed there is for good reason, because it's encompassing things from solid waste, vector disease control, food services is a big component of it and a big component of your test. And the code can be very in depth, but understanding the risks of that is the big part. So for our trainees, we want them in the field with us, but we also want their head in the books. And sometimes it does require a little bit of testing out of the office, or sorry, of like studying out of the office and getting used to test taking, because that is part of it as well, is understanding in this test what is the questions that have the most risk associated with them for a given scenario, X, Y, B, Z. It's hard to all give you scenarios right now, but the hours that's required for this job to become registered through your trainee is necessary. So, but that's how we do it, is give you a few months to be in the books, but you're also in the field with us. So
great. And Julie, is the process for trainees kind of similar in Clackamas?
Yeah, that's a good question. So yes, we also follow the state requirements for the hours, and we have staff that do all share time going out and working with our brand new trainees to do field inspections in each and every area. Our inspectors tend to be generalists, so they do work in every single one of those areas rather than being assigned to just food or just pools. They have to learn the codes and the risks and the nuances of every single field, but we spread it out. We work with them very much in depth over the 2 years of the training period. I also had saw a question from Karina in the chat. This might be a good time just to help answer that for you, Karina, about job postings that mention health specialists being registered or certified in Oregon, and is that a requirement prior to starting a job? I can mention that each county might vary a little bit in what they require. For a trainee position, we work with the candidates. We know it's a big investment of time and expense to get fully registered as a trainee to start off. So if we have a candidate that we really, really like, we want them to at least go through the first steps of getting their transcripts screened and passing the rules exam before we can make them an offer for a job. So we know for sure they can meet the requirements of education. And then we ask them to finish the process and the final cost of that at the time of the offer before they start working for us, before their first day. So they would have that license in hand when they start on their first day. So that's how we do it in Clackamas. But again, other counties might vary that a little bit. So.
And so that's referring to you have to register with the state as a trainee initially. This is even prior to becoming fully registered environmental health specialist. So even for a trainee position, you have to have the state licensing board look at your transcripts and say, yes, you meet the basic qualifications for this. And there's a 25 question little exam that you have to do online. And then you got to pay them some money. So you got to pay the money. So
Can I follow up on that?
Yeah, please do.
Yeah, I had something similar for a different county, not Clackamas, where they wanted registered trainees applying through the state licensing board, and there's an application form and a fee and whatnot, and you send transcripts. And the state licensing board, if you do that without a job in hand, will tell you you are rejected because you don't meet the requirements. So it's a bit of a roundabout process in my experience for this to be the mechanism of transcript verification, is requiring application to something that the information on the web and from the licensing organization will tell you you aren't allowed to get yet.
Yeah, do you want to, Kyle or Julie, do you want to talk about that? Like how does that work? Do you apply to a trainee position and get a conditional job offer and then go to the health licensing board? Or how does this work? What is this chicken and egg thing?
Yeah, and I can say the Oregon Health Licensing Office has done various responses throughout my career here in Oregon, but currently that is what my recent experience has been with our candidates when we've been recruiting. We've recruited a couple new environmental health specialists as trainees over the last couple of years. And so, yes, when we are ready to make that conditional offer, that candidate is then asked to reach out to Oregon Health Licensing, because we've heard the similar experience from that David's describing when people approach it without that conditional offer in hand.
So specifically for Clackamas, one would apply without filing the licensing board paperwork. And then if you end up being a lucky person who's a promising candidate, then you work with the licensing. So
Correct.
That's the secret. So it's a little bit different than
we are trying to work
through.
with, absolutely. We're trying to work with, and then we might find out, the next time we're hiring, Oregon Health Licensing has adjusted how they're
Sure.
doing that, and then we'll adjust, based on what we find out. Sometimes we don't know until we hear back from a candidate that said, oh, I tried to do that, and they gave us that feedback. And if we really are interested in a candidate, we try and work with them as much as possible.
That totally makes sense. Thank you.
So in preparation for this presentation, I spoke on the phone with the Environmental Health Registration Board, which sits in that health licensing office at the state. And one of the things, they weren't able to be here, but one of the things they really wanted me to convey is that the requirements to be a registered environmental health specialist, and the trainee is underneath that, right? Are written into statute. And so this is in law in terms of the requirements, what you have to meet to become one. And therefore it can only be changed by the state legislature. So they have no control over like what this they have control over the process, but not necessarily like what you have to actually accomplish in order to be one. And also folks like Julie at the county level also have no control over that, like is this set in statute. The good news for all of us is that the legislature literally just updated the language in the statute of kind of clarifying and updating the language around environmental health specialists. So that was SB 844. It's a housekeeping bill. There was a lot of other stuff in it. But on page 4, if you want to read that document, which is linked here, it has the environmental health specialist requirements and the updates to it. They didn't necessarily change the number of hours or the number of credits of science you have to have, but they did make some key updates that I think will really help open the field up to more candidates and make it a little bit easier in terms of the credits that can be counted towards the requirements, which I'll talk about in just a minute. Now, because this is so new, like literally the ink is just drying from the governor's signature, okay? So their website has not been updated yet with these little tweaks and changes that were made. Again, it's not changing the requirements, in a huge way, but there are some key changes there. This is the link to their website. It is not updated yet, but it will be soon. So they have some time to write the rules around it and implement that. So just know that that will be updated soon. And then we will all have the benefit of having a little bit more flexibility. So let's talk more about the qualifications for getting into these trainee positions. So I've taken this kind of verbiage directly from some position descriptions here. First of all, you do have to have a bachelor's degree with major coursework in science. That's 45 quarter credit hours. This was one of the areas that was updated in the new statute here. Previously, it had to be in, quote, environmental sanitation, which really doesn't even like exist in the field. It's kind of an old verbiage. And so here in highlighted, this is the new verbiage around what types of courses you have to have that count towards those 45 quarter credits. It's in public or community health or in sanitary, biological, or physical sciences. So that's a great change because more things are going to count in that category than were previously. You have to have a driver's license and a clean driving history because you're going to be driving around the county a lot, right? Also pass a criminal background check typically. And also able to meet the standards of environmental health specialist trainee that are outlined there. And then have the knowledge of county, state, federal laws, regulations, and ordinances governing environmental health and safety. That's on that 25 question little online exam that you have to take when you register as a trainee. But for Julie and Kyle, like what else are you looking for when you are hiring folks into a trainee role? Tell us a little bit more about what you're looking for in candidates there.
I can go first. Just honestly, the ability to critically think. That's one of the biggest things that we talk about with folks is understanding the magnitude of kind of what you're looking into for a given facility. It's very important to have that in your background. And you're quizzed on, like I said before, you're quizzed on this during your exam too, and trying to understand, given a certain scenario, what is the biggest thing that you need to address right there and then what's the next biggest thing, and understanding that kind of process in terms of the general safety of the situation. What else? I mean, having some teaching experience is great too, that we look for when it comes to EHS or trainee. And then part of that teaching experience is how can you explain complex topics in simple terms and adjusting to people's backgrounds. A lot of our operators do not have college degrees. A lot of them barely have GEDs. That's not to say something negative about them, but that is their actual background. So trying to tell them, oh, these microorganisms are growing in the food, blah, 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 that doesn't register with them very well. But understanding the fact that, hey, when it comes to cooling your food quickly, reheating your food quickly. You need to do it this way because you could have foodborne illness, and keep, just being able to explain those topics to people. And so that's what we look for when it comes to trainees or people that are previously licensed in other states and in terms of hiring them. So,
Julie, anything you want to add to that?
Oh, yes. And thank you, Kyle. That was such a wonderful description, and I agree with everything you said. I also want to point out a lot of our counties are very diverse, or at least Clackamas, and I know Multnomah and Washington counties up here in the metro area are very diverse. And so we really want someone who's comfortable working in all types of facilities. We have corporate, we have privately owned, we have different rural and urban. We have different ethnicities, all kinds of diversity in our community. So we want somebody who's comfortable and able to connect and communicate well with everybody in our community. And we like people who are flexible and who like working in a team, but are also comfortable being independent and are able and responsible to be able to organize their own day and lead their own work and ensure they're meeting their own standards. We definitely work with them, but we need people who are comfortable being able to be out on their own once they get fully trained. Yeah, I think there's a lot of other aspects too. And I would say, if I can't take somebody out on an internship, I'm happy to chat with them more about what we do, even on the phone. That's the least we can do. And so, if you're interested in can't do a ride along, feel free to reach out to one of the counties and ask just to chat with one of the environmental health specialists to get an idea of what the job is like and if it's something you'd be interested in.
That's great. Thank you so much.
Mhm.
Also, just to kind of follow up on that, because we do see these trainee positions open up periodically, about how many trainees do you take on every year, Julie? How many folks or positions are you recruiting for typically?
Well, it is sporadic. And so our primary team in Clackamas County has for the food pool, lodging, and childcare, that work. There are 7 inspectors. Our county, we divide it up into areas, and each person is assigned an area that they do all the routine work in. Of course, we always cover for each other as well. So somebody's out on vacation, or we have a vacancy, or somebody's just overloaded from, a whole new shopping center with lots of planer views. We work as a team and we help each other out, of course. And then we have 2 people that cover most of our drinking water program. So when we're fully staffed and people aren't leaving and we don't have enough new facilities to add a position, we could go years without having a new trainee added. And then we might have a period where we have some retirements or somebody that's moved out of state where we might have, 1 or 2 vacancies. We had 2 last year, and then before that, we didn't have anybody for a couple years prior to that. And then so it is kind of sporadic, and it's hard in our county to be able to predict when we'll have those openings.
Great, thank you. And of course, Clackamas County is a pretty big county, and so you have more staff than a really small county would have too, as well.
Of course.
Kyle, do you have any advice for people who will be applying to trainee positions? Like, what do you think they should emphasize in a resume, cover letter, for example?
So the advice is to read through the jobs list of duties very carefully and understand what your strengths are for those duties, and be upfront and honest about your weaknesses too. Because if you don't handle tough situations very well, sorry to say, you might not be able to do this role. It just depends, because you kind of have to have thick skin sometimes in working with some testy operators. I'll put it that way. And I know in terms of the licensing process, it can be daunting, but when you're applying for these positions, don't be afraid to do some homework. Call that county, see what they're kind of looking for. Call the health licensing office and double check some things if you have questions about it. But that's kind of my advice for sure. In terms of the resume, or you wanted that as well, like what they want on a cover letter, resume. Man,
Mhm.
your ability to work with a range of clients is so necessary. Everyone has different educational and social backgrounds. Just be aware of that when you're applying for these positions. So
That's great. Thank you. That's great advice. Okay. So we talked a lot about requirements of the job, how to get into it. Now let's talk about where to find the job. So one of the things that I do in my position at CLO is to help promote open jobs in public health departments. And so whenever there's a vacancy in Klamath County or in Clackamas County, I try and help get the word out about it. We do that a few different ways. Now, a lot of you might be already familiar with these because you're here today, and so you found them through these different ways. Every single week on Wednesday, we publish a job spotlight newsletter that has vacancies from every single county across the whole state of Oregon that is on LinkedIn. And so you can subscribe via LinkedIn, and then it'll come to your email address every week on Wednesday. So in there, you will see environmental health specialist trainee positions. You will see registered environmental health specialist 1 or 2 or 3 level positions. So we've also recently had environmental program manager or program director positions. And so that's where you will find it. We do also include in there if there's any paid internships, we will put those in there as well. And then of course, we have webinars every single month. So this is our special topic webinar for July. But we also have regular webinars throughout the year that you can join in on. And then I also offer individual job coaching sessions if that's helpful to you, if you want someone to take a look at your resume or cover letter. I'm happy to do that and give some feedback. And so there's just a really easy Zoom scheduler link on our website, and that's the QR code there too. And everyone on here is going to get these slides, and so then you'll be able to, click on that and find out where to find that as well. But for Julie, kind of wrapping us up a little bit here. Tell us a little bit about the benefits in general of working for the county. What are some of the benefits, some of the perks of the job, or that you might want to call out there?
One of the things I love about working at the county, especially in Clackamas County, I'll put a plug in, because I've worked in a couple jurisdictions, but you really, and I would say this actually applies statewide too. Environmental health field, it's smaller, than say the field of nursing. And if you really make an effort to connect with your team members, your fellow environmental health specialists, both at the county and throughout the state, you get a chance to sometimes go to conferences or trainings or meetings where other environmental health specialists from other counties are there. It can be just a really nice family, a really nice colleague support, so that when you are out doing your job and you're by yourself in a facility, you have a group of people that you can go back and talk to about things you're not sure about, or when something happened, and have their support and their ideas. And I think that opportunity to really build those connections and almost like best friends or family members is really helpful. You work really closely with your team. So I really like that part of it. Of course, there's the benefits that our HR team provide at the county for county employees, the health benefits, the vacation, the holidays, the sick time. I also love the flexibility of being able to, when you're in the field and doing the inspections, being able to plan out your days. Just like they said in the video, if you have a lot of energy, you can go out and do all your hardest facilities on a day, or if you're just, feeling low energy, you can plan your day, how it fits you too a little bit. So I love that flexibility and independence as well.
Thank you so much. And Kyle, do you want to tell us a little bit about career advancement and the opportunity to grow in your career?
For sure. There's definitely opportunities to climb what I call the leadership ladder in EH careers. Becoming a supervisor is just one of those opportunities, or being a manager for an EH division. Two of my past environmental health specialist workers when I was back in Kansas have went on to become county administrators or directors of a health department. So they took their experience from environmental health and they used that quite a bit in becoming where they are now. A coworker that I had here left a year ago to become one of the main auditors for a seafood harvesting and shipping a regiment up in Alaska, making good money with Tricor is the company. And so just a lot of advancement opportunities in this field. In fact, I actually left environmental health for a job in the USDA after 4.5 years as an EHS. Went off to the USDA to become a soil nerd again. Came back into this field because there's such a high demand for it, and because I was already equipped for it. So not even just career advancement, but just, hey, if you want to dip out, there's always that opportunity of this just being there for you. So
That's great. And actually, in our video, Mike Baker, who is the director of public health in Jefferson County, was also an environmental health specialist when he started out in public health. So definitely is a career ladder there in leadership opportunities. So thank you for highlighting that. And also really portable careers. So, once you're a registered environmental health specialist, you can do that job anywhere, right? Like there is a lot of demand for that. So I think it's a really portable career as well, in terms of if you have to move, or, you can find this job all over the place. So with that, this is our open Q&A time with our wonderful experts. And so I'm going to stop sharing these slides so we can see everyone's faces here. And please feel free to ask a question if you want to raise your hand, or we can go back through and make sure we got all of our questions answered from the chat as well. And I just want to go back and respond to Helen's question earlier. Helen, I'm sending the slides out here in just a moment. So you will get all of those links that are embedded into our slides here for you. So don't worry about that. You will get them. Yeah, with that, let's open it up. Does anyone have any more questions?
I could go ahead and throw a question your way.
Yeah, go for it, David.
Thank you. I was checking out on the Oregon CLHO website. There's a May annual report, and I noticed that the hiring recruitment methods of county public health was not what I would have expected as an outsider. It seems like the really big routes in are through internship or word of mouth. And just seeing a posting that you meet the requirements for and applying to it was like this tiny little sliver under 7%. And that was both surprising and kind of disappointing. I am interested in public health. I'm getting a degree in public health currently while I'm working my more or less unrelated job. And I would be that slice that doesn't have an existing network in public health here in my programs in California online. And so I was wondering if that kind of division of routes in like matches how you actually see it in your counties. And I was also wondering how to build those connections and get seen and get known as an outsider if that existing network isn't really present. I know, Jenny, you had made me aware of there's an annual environmental health meeting coming up in October. I don't know if it's reasonable to go to that kind of thing as someone who's not currently working in the field but interested in it, or other ways to get seen. I'll add that the internship isn't really workable because my full-time inflexible job is how I pay for the school to be able to do public health in the future. But yeah, any reactions or comments or guidance on that would be really appreciated.
Thank you so much, David. And I think you're referring to our workforce report, which did just come out and highlight some of the
Exactly.
challenges of recruitment. Yeah, absolutely. So either Julie or Kyle, you want to take a stab at this? Like, how can people kind of get into the field? It does sound like a lot of folks are starting right after sort of an undergrad, but for somebody who wants to pivot into this field, you know, like what's David's best approach here?
Oh man. So how do I get into this? So it's funny you mentioned kind of just the annual meeting. Our latest inspector who just left for lunch, he literally showed up at the annual meeting and was like, I'm interested in this field. What do I do to get involved? And we hired him, you know, later on, but that is legitimately how he got involved, Adam, how he got involved. Like for me, how I got into this was the fact that I just had my background in EHS already, so it was kind of it wasn't foreign to me. But I do recommend reaching out to those EHS workers and saying, hey, I'm just trying to learn about your job and what you do. What's kind of networks that I need to be paying attention to, or job postings, those kind of things. But undoubtedly, for sure, I think there is room for improvement in terms of broadcasting our needs in terms of more EHS workers. So good points, David.
Thank you, Kyle. And that bit about your colleague is encouraging, because I was considering showing up at this thing coming up in October, and it sounds like I wouldn't be looked at like I have 3 heads or laughed out of the room. So
no,
that's an excellent, encouraging little bit of info for me to work with.
Yeah. Julie, do you have any comments for that too?
Oh, sure, I can join in. Yeah, and I know when we have an opening, of course, we have our LinkedIn postings, but I also reach out to the Oregon Environmental Health Association. They have a website. It's easy to find if you type in Oregon Environmental Health Association, or OEHA. They have a page where they post job openings. They don't always take it down quickly once it's closed, but we do put our postings there. If you're lucky and you apply and get an interview, I love it when people take the time to look at our website and just read what we do. And then we like to send our interview questions to our candidates ahead of time. So if you get an opportunity to interview and you get the questions ahead of time, try and think through like how, you know, what the question's asking and how it would apply to this kind of work. And even experience like working at a restaurant. You know, you're doing food. Oh, sorry, my light keeps going off. I'm sorry, I'm not moving enough. You know, even that experience in a restaurant, you know, as a dishwasher or a busser, you can think about how to talk about that experience. It can be very relevant. Our last candidate we hired had some volunteer experience in a food pantry program, and it was great. She was able to talk about how she learned about food safety systems as part of that experience, and we used that to her advantage because she explained it very well. So I hope that's helpful.
Yeah, thank you. The knowing where to look, like the OEHA website for the postings that are out there, hasn't been a problem. I was thinking more the distinguishing oneself from the lumpen masses. But yeah, thank you for that.
Of course. And then I think if I can, you know, add one more thing too, when we're interviewing candidates, I really appreciate when someone has a really compelling why do they want to do this work? And so, you know, think about that as if you get an interview, why would you want to be an environmental health specialist? And that can really help a candidate stand out as well.
That's great. Thanks.
Uh-huh.
All right. And I see up here, Helen has a question. So for folks who are international, breaking into a public health role here in the United States is a little bit tricky because most municipalities are not going to sponsor work visas. And so that is, you know, on all the position descriptions at the bottom for county jobs, it will say we don't sponsor work visas. So you do have to have a work visa in hand when you apply to any positions. So just FYI. And Julie, did you want to add anything to that or no?
Oh, I'm sorry. Can you repeat that?
Oh, okay. I just thought I saw your hands.
Oh, no, somebody was at the door and I was just
Okay.
letting them know I'm still in this
Yeah.
meeting.
No worries. Okay. So anyways, so yeah, so for anybody who that applies to, just know that you have to have those work permits in advance. And then Karina says, you mentioned this position's portable. Once registered, I know you can work pretty much anywhere in Oregon, but can the certification or registration obtained in Oregon translate to other states?
It depends. So not even just states, but different counties as well. So for example, if I were to take my accreditation from here and move back to Kansas, each county in Kansas is different, or used to be different. I don't know if if it's changed since then. Each state may have a different adoption of food codes or regulations, where they might not accept what you know in terms of your base of knowledge for your exam as being reciprocated, basically. So we have some older version of the food code, but if you go to New York, maybe it's a different version of the food code that you have to go through the examination process again. So just depends. Yeah, just depends.
And in our statute here in Oregon, there is reciprocity. And so if someone were certified through the National Environmental Health Association, for example, they will honor that here. Or if you are fully registered in another state and in good standing, they also will honor that here. So I do think a lot more states are kind of trying to open that up more and not have it be quite so onerous, but there's definitely still local food safety, etc. regulations that are going to be different. So they may have you still do some kind of training or take a different exam, etc. But yeah, every single state is different, unfortunately. So okay, let's see if we answered all of our questions in here. We got them all, but if anyone else has another question, we have time for one or two more.
I can do one more. I come from a infectious disease background, and that connects into environmental health, but a lot of the emphasis in many of the counties on food and restaurant and inspections, which has a food safety infectious disease component. Is it reasonable to come in with the goal of gaining experience in environmental health in order to do other things in local public health, or is it more desirable to be in environmental health as like the one and only, the biggest dream and goal driving people? Does that question make sense?
I can jump in, Jenny, if you want. I think so, David. I think I hear what you're saying is, as an applicant to a position in environmental health, but looking at other potential fields later after you've had some experience within environmental health. Is that reasonable? Is that what you were asking?
Yeah.
Okay.
Yeah, that's a good way to put it.
Yeah, I will say when we hire somebody, we know, there's no guarantee they're going to stay in environmental health doing inspections forever. And, even at Clackamas, we've had people promote, to the state. And it's hard to lose them because we put so much time and resources into training, and we feel like a family here. And so it's like, if they stay their whole career and they retire, that feels wonderful. But it's also kind of cool, and I take it as a compliment, when people do promote, and somebody mentioned there have been environmental health specialists that promoted to senior and then leadership positions and then go on into director positions. And they're no longer, serving as an inspector or an environmental health specialist, but that's really cool too. So it's hard when somebody turns around and leaves, after 2 years because we've just finished really putting our resources in and training them. But, it's not the end all. So it's kind of a both answer, if that makes sense.
Absolutely. Thank you.
Of course.
It is a really big investment in the trainee process, both for the person who's in a trainee position, but also for the department, because you're putting a lot of energy into training that person. So you want them to stick around so you can recoup some of that. And also just as an applicant, you want to be able to work in that field, and so you're recouping your investment of your time, which is also important. So thank you for that question, David. Just a note about communicable disease and kind of epi work, though. Are there environmental health specialists that kind of focus more on epidemiology?
Well, the outbreak investigation that Kyle was talking about certainly links up to an epidemiology skill set.
It is something to where I will clarify that there's separation a lot of times, though. Us EHS will do the groundwork in terms of trying to understand what this person experienced in terms of symptoms, what did they eat, what were their past meals, those kind of things. But we do hire out to an actual epidemiologist that will kind of connect the dots and has access to our electronic medical record system, Orpheus. And they'll be the ones to kind of direct us what else kind of field investigations we need to do. So it does help, but what we're mainly asked to do is a lot of the field work, is in terms of gathering information. So yeah.
Hi, I'm Michelle. I just wanted to kind of add on. So I also have an infectious disease epi background, but while I was working in that area, I noticed the amount of overlap between environmental epi and infectious disease epi. So that sort of led me to become more interested in environmental health and environmental epi. So I'm just kind of curious, in applying for these jobs with someone like my background, how transferable do you all see those skills as being?
Very.
Because when I read the descriptions, I start to feel like this doesn't sound like what I've been doing, and I'm not sure they're going to see how my skills transfer.
So the impacts thereof from, say, someone not doing a certain food safety thing correct, that's where your skills transfer is. This is the outcome of the foodborne illness, or these kind of things that you can trace to. But like I said, we're the point blank, like we're the field inspectors that do the prevention component. And that's the overarching thing of EH work is prevention entirely. We don't notice it in a good society. We don't notice the social safety nets that we have because we do what we do. And so it is transferable in terms of epidemiology, because when things go wrong, you can actually put the pieces together. But all of EHS work is mostly for the preventable aspect of things. Please don't have your walk-in cooler at 65 degrees. Should be common knowledge, but we find that time and time again, as Julie probably knows.
And I would also just add on to Kyle, we had actually an environmental health specialist who had a master's in public health with her focus work in epidemiology. And I loved her strengths as her analytical component that she brought to the team. She asked amazing questions and really helped us dissect systems and patterns in things that we were all seeing, and really helped us when we were trying to identify things that we might be able to reach out and do community-wide messaging or interventions. So we decided we were going to invest a little money and print a sticker. And so just her ability to really help us use her epi lens in our work helped us strategize a little bit and do more of that prevention work that Kyle was was mentioning. How many deaths did we prevent? We'll never know. How many illnesses did we prevent? I'm not sure, but I know we've done good work. Just like people use smoke detectors in their house. We don't know how many lives a smoke detector in a house saves, but we know they do and we know they work. So I think, yeah, an epidemiologist brings a huge skill set to a team that maybe doesn't have that, and it would be very valuable.
Okay, thank you.
Yeah.
That's so great. And I love that analogy with the smoke detector because you're out there every single day doing this work in the heat and helping our community in so many ways that we will never even know. And so I just want to thank you both for taking time out of this very busy season for environmental health to help kind of pull the curtain back and help our future generation of environmental health specialists break into the field. So with that, I'm going to say thank you so much, Julie. Thank you so much, Kyle. And thank you, everybody who joined in today. I'll be sending the slides out afterward, along with the recording in case you want to watch it back later. So we appreciate all of you.
For sure. Thank you, folks, for attending. I'm going to put my email in the chat. You can always send me questions if you'd like to reach out to me to learn more. And I'm going to toot the horn one more time that this job is very portable. We only cover the EH spectrum of things. You can move on to industrial hygiene, quality control, quality assurance. There's so much possibilities with this job.
Thank you, Kyle.